We're going to start by talking about the alternate Kentucky summative assessment. Often we just refer to this as the alternate assessment. Each year, the Admissions and Release Committee, or the ARC, should take time to determine whether or not a student is eligible for participating in the alternate assessment. This can include a review of data from progress monitoring, from the present levels of performance. It could include evaluation data such as psychoeducational reports, adaptive behavior rating scales, curriculum assessments, diagnostic assessments, and any other student work or progress monitoring that you want to include. So, the first question in the participation criteria is pretty easy. Is the student eligible to participate in special education to receive services under IDEA? More than likely, if you're filling out these guidelines during an ARC process, the parents have given consent for services. The student has been determined to be eligible for special education services. So this is an easy one. We're going to mark yes here. So let's think about participation criteria number 2. Does the student have a deficit in both their cognitive functioning and adaptive behavior? Notice that it says in the home, school, and community. That's important because it means that their disability impacts all aspects of their life. For example, if a student has poor hygiene and self-care habits, it impacts them at home, where most self-care, such as bathing and brushing your teeth and hair, occur. It could cause difficulties with making and maintaining friendships and social interactions with peers at school. It could even prevent them from getting a job in the community. So while hygiene for most students is taught at home, students with cognitive and adaptive delays need opportunities to practice hygiene in school in order to back up or supplement the skills that they would generally learn at home. The student may need constant supervision in order to stay safe, requiring a specialized program in school. Additionally, even with accommodations and modifications to the curriculum, the student is unable to access the same academic supports as their peers. It goes on to ask, does the student require extensive individual direct instruction, including intensive accommodations, modifications, and assistive technology? So let's talk about that. What does it mean when we say intensive accommodations and modifications? So let's give some examples of what intensive accommodations are. The accommodations would be ones in which the student needs at all times across multiple settings and has demonstrated the need for these over time in order to achieve a level of proficiency. So, for example, in instruction, we're breaking up the lesson into smaller parts. We're using systematic instruction. We are narrowing the focus, pre-teaching concepts, giving visual cues, or reducing the amount of work that the student has. For the setting, we may have the student working one-on-one with a teacher or in a small group or with a peer, but they're going to be in a setting that is different from that of their same age peers, smaller setting typically. For materials, we're using concrete objects, picture banks, pictures that represent words, hands-on activities. We're limiting paper and pencil tasks. We're using visual directions, highly organized materials. For communication, we want to think about how the student demonstrates their learning. So they may use an augmentative and alternative communication device, or AAC, that's programmed with picture symbols, vocabulary for instruction and engagement. A modification changes what's being taught or expected from the student. This supports the rationale for why something different than gen ed is needed, but grades still need to be given based on the curriculum that's taught. IEPs are embedded into the curriculum. So let's look at modifications and examples of what that looks like for low incidence. For instruction, we want to use things that are standards based. We use repetitive instruction. multisensory at a concrete level, adaptive text, graphic organizers, and discrete trials. For settings, we would have a highly structured work setting with tasks and activities developed individually for the student. We might have a quiet work area, increased supervision, and individualized scheduling for the student. For materials, we're going to use visuals, kinesthetic, manipulatives, task boxes, a calm down area, and break time activities. For communication, functional skills are embedded into the lesson. They're using their AAC devices. They're receiving support from the SLP or the speech language pathologist, and they are working on picture communication skills. Additionally, in criterion 4, they talk about assistive technology. So let's think about assistive technology. There is a difference between assistive technology and classroom technology. Classroom technology is what every student can use. So if you look at these two pictures, the student on the left is using a computer, and he might be using that for school, but it's not assistive technology because it's something that everyone has access to. On the right, we have a student who needs assistive technologies. The tools that she is using assist her with accessing the curriculum or her environment. So without the switches that are available to her, she wouldn't be able to access the computer that is on the screen to her left. So she needs that in order to be able to participate in the curriculum. And that's kind of the difference. She needs that, where the other student is using it as part of an everyday lesson that they're getting with everyone else. So additionally, there's augmentative and alternative communication, or AAC, and there's lots of different types of AAC. We can go everywhere from no tech, which is displays of emotion, facial expressions, vocalizations, gestures, signs, speech, to lower tech options like objects, miniature objects, tactile symbols, pictures that could be photographs or line drawings, some kind of picture communication system or a core board. Next is light tech, and that's a static voice output device like a Big Mac switch or a Go Talk or a Tech Talk 8. So these are things that the student can press and a voice will come out, but it doesn't change based on the need of the student. High tech, we generally refer to things with dynamic display, things that have speech generating devices. That includes like a Tobii Dynavox iPad with a communication app. And this typically the student, for this high tech, the student is required to be able to categorize and understand how words fit into that device. So it's not that simple, push and something will come out voice output. It's something that the student really has to be taught over time. It's really important to understand that this is not a hierarchy. It's really about matching the features of the technology to the needs of a student. For example, not all students are ready for that dynamic display. They don't have the skills yet to do that. But we're going to try to use other things that will help the student to understand how to use their system so that we can progress and maybe use something that's more complex that will allow for more communication. So now let's talk about criterion 4, and this includes exclusionary factors. These are important because we want to make sure we aren't qualifying a student for alternate assessment for the wrong reasons. And I'm just going to point out a few to talk about. Excessive or extended absences. This is the student is below grade level because they have excessive absences. That's not a significant cognitive disability. They've missed content. And if that's the case, then alternate assessment really isn't appropriate for them. We also include native language, social, cultural, and economic differences that are, or if the student is identified as an English language learner. All students will potentially struggle adjusting to new culture or language, but it doesn't mean that they have a severe cognitive disability. That's to say that we can't have a student that's an English, that's not to say that we can't have a student that's an English language learner that it also has moderate to severe disabilities. But we need to make sure we've discussed this in the ARC and we've determined that we're qualifying them based on their disability and not on their English language skills. And this is just a reminder the area of eligibility supports access to services, and the ARC team will need to have a member with language acquisition expertise. So, we need to have an interpreter for parents when we're having a meeting for a student that's an English language learner. The next is behavior. While some of our students with moderate to severe disabilities do have behavioral issues as part of their disability, it should not be the only reason for alternate assessment. So we're not just saying it would be a lot easier if the student was on alternate assessment based on their behavior, or perhaps their behavior is really the barrier between um, whether or not they're on grade level and not really their cognitive disability. The educational environment or in the instructional setting is important as well. Just because a student is receiving services in a resource room with other students on alternate assessment or what we call an MSD self contained classroom does not mean that they automatically qualify for alternate assessment. Placement does not dictate their assessment, it's based on the needs of the students. Also, not all students participating in alternate assessment will automatically be in a self contained classroom. The student may spend the majority of their day in general education classroom and still access the alternate assessment as part of their least restrictive environment. Finally, the Learning Characteristics Inventory was developed by the National Alternate Assessment Center in order to investigate the true learning characteristics of students participating in alternate assessment based on alternate achievement standards. The Learning Characteristics Inventory asks questions about the student's disability category, English language, back to, if they're a native speaker or not, classroom setting, expressive communication, oral speech, if they use AAC, receptive language, motor skills, engagement, reading, and math. This is completed annually as part of the student's alternate assessment records. A large emphasis is placed on communication in the Learning Characteristics Inventory. This is because communication is a huge component of learning. A student must be able to listen and understand what is being said, which is their receptive language, and they have to be able to show what they know through their expressive communication. So these are really major parts of the alternate assessment that we consider.